you would think that folks in the medical system would be a little bit more familiar with uh, treating the body kindly or treating people
Mm,
kindly who
mm,
need extra supports in the medical system. One of the things that I notice keenly, certainly every time, and I'm based in Vancouver, so we've got large medical systems all over the place here. When I visit the eye
mhm,
care center, and
mhm,
there's certainly people there that have white canes. There's a lot of
mhm,
people there who have low vision, or are legally blind that are not trained on white canes yet, or are in denial perhaps that they need a
mm,
white cane because they're still visiting ophthalmologists and are in the aging process and things like that. I proudly carry mine now, but I had a fall. Actually, I didn't have a fall. I
mm.
tripped. I
Okay.
tripped, which is a different thing.
Mhm,
Had a chair that was the leg of the chair was sticking into a door frame,
mhm,
and
mm.
so I didn't expect it to be there. And I tripped with one leg when my cane was on the other side, and I fell into a wall and I hit my
Oh
head.
dear.
It was
Oh
it was
dear.
quite nasty. But nobody knew how to actually even pick me up off the ground, right? Like I had
Mhm,
hit my neck and
mm,
could have been quite bad, and they wanted to just pick me up. It wasn't documented, wasn't anything. In the 15 years I've been going there, I've never once been offered sighted guide, and I go there every 3 months. Nobody knows what the white cane means, and this is the eye care center. And so it boggles my mind that people don't care. They call you by name. They say, follow me, right? I'm over
mhm. Yeah.
here.
Yeah.
All of those kinds of things. And even when you're getting your eyes examined, it's, look at the dot on the screen and it's like, I can't do that, right? Like,
Right.
why are you putting me through this test if you know I can't see the air balloon in the distance, right? So then you get treated poorly or patronized. Or when doctors are speaking to, they speak to you like you don't understand your own condition.
Mm,
And so you have to learn to be your own advocate or bring in an advocate with you.
mm.
But the thing about that is, and I'll take a quick moment to mention,
Mhm. Yeah.
I always need to bring somebody with me to drive, like to drive me to some of these,
Mhm.
guide me in
Sometimes
a
it's
class.
required. Yeah.
So just, I go for a lot of MRIs for another condition, and they always give you a sheet of paper that talks about, last surgeries and, current conditions and do you have this and are you pregnant and all of those things.
Mhm,
And for me, oftentimes it's my father that drives me and they hand him this form and ask him to
mhm.
fill it out for me.
Yeah.
And I say, well, actually, I would like somebody from the medical staff to sit with me and fill it out. And they said, well,
Yeah.
why, you brought your dad? And I said, no, no, my dad's driven me, but I don't
Mhm,
necessarily want to give all of my medical
mhm,
information. I don't need him to know if I have a sexually transmitted infection
mhm.
or if I'm pregnant or like those are
Yeah.
private medical things, right? And
Mhm.
so I should
Yeah.
be able to have a medical person go through my medical questionnaire with me before I have any kind of procedure or test. And that should be my right, separate from whoever drives me to my appointment. Lucky for me, I'm okay with my dad doing that, but it's the principle of it.
Yes, exactly.
That those things are for some people very private, and
Mhm.
it should be our right to be able to have somebody in the medical system that will sit with us and fill out forms.